Hi, my name is Dr. Tarang Vora. I am consultant pediatric neurosurgeon at Apollo Hospital, Jubilee Hills. Today we are going to talk about surgery for children with cerebral palsy. So in India, nearly 15% of physically disabled children are affected by cerebral palsy. It is estimated that around 3 among every 1000 children that are born in India suffer from cerebral palsy. So what is cerebral palsy? Basically, your brain controls all the movements and tightness of all the muscles in your body. Cerebral palsy is a disability in which the brain is damaged and not able to properly control the body and muscle movements. This particular type of brain damage typically occurs during childbirth when the supply of oxygen to the baby's brain is temporarily interrupted. A child with spastic cerebral palsy has excessively stiff muscles, which can be mild or severe. Mostly they affect the lower limbs more than the upper limbs. Muscle stiffness can make it very difficult for this child to move certain parts of the body. As in all the cases, the injury to the brain cells cannot be reversed, but we can find an alternative way to make the disease less disabling so that these children can become more independent. So what do we use this surgery for? Surgery is basically used to relieve the stiff muscles, correct the spinal curvature, reduce the tremors, correct the abnormal shape of the foot or correct the foot deformities, improve the posture, improve balance and coordination, relieve pain, correct fixed joints and tendons contractures, prevent spinal deformities and prevent permanent tightening of muscles that are contractures. The main purpose of surgery is to make the child's tightness in the muscles more manageable and to prevent any future complications. More importantly, surgery can increase a person's quality of life so that he can lead a more independent life. So what are the types of surgery that are available for kids with cerebral palsy? They are generally orthopedic procedures or neurosurgical procedures. There are a variety of procedures that may correct the issues and secondary conditions associated with cerebral palsy. Surgery is generally indicated to improve movement, posture and gait. So let's start with orthopedic surgeries. Orthopedic surgery basically improve the mobility. They are basically beneficial in treating muscle tightness and prevent future contractures, basically in hips and ankles. If your child has any joint dislocation, pain or problems with wearing shoes, the orthopedic surgery may be able to improve their condition and overall comfort. The main orthopedic procedures that are generally available are tightening or lengthening of the tightened muscles or lengthening of the tendons, which are the elastic bands that join the muscles to the bones. Likewise, we have neurosurgical procedures for cerebral palsy. The main neurosurgical procedure for cerebral palsy is one that is for the abnormal curvature of the spine, that is scoliosis surgery, and the second one is for the tightness in the legs. There are two available neurosurgical procedures for tightness in the legs or spasticity. The first one is using a baclofen pump, that is a refillable device that is implanted in the spine that releases a medicine called as baclofen to reduce the nerve impulses that control the tight muscles, making them loose and normal. Second is a fantastic new surgical procedure called as selective dorsal rhizotomy. This basically means sectioning the nerve which control the tight muscles in the lower limbs of their child. Question is, which of this surgery will benefit your child? The type of surgery that would be best for your child depends mostly on the clinical status of the child. Generally, children who can walk with these tight legs, mostly these are toe walkers, these children have great improvement in walking, sitting, standing and balance with the surgery. If your child or any child you know has cerebral palsy, please get the child evaluated by a pediatric neurosurgeon to see if your child can benefit from surgery. Thank you.